scapular and also the humeral technique to therapists. So the common pattern for people with scapular problem is as they dip their scapula, they tend to do this. They'll elevate the scapula, and then they will laterally glide the scapula and laterally rotate the scapula. So those are the common positional fault. So we want to correct. So in addition to that, they often have increased V angle. V angle is this angle here between the spinal scapula and the clavicle. Okay, so they often have increased V angle. So we want to correct that positional fault as well. So there are 4 components we want to correct. So elevation, scapula. We want to correct lateral glide, lateral rotation, and then the V angle. Okay, so we wanted to correct those. You can do it with 2 therapist technique. Let the patient sit down here. Okay, so have an assistant standing here. So this, you say this arm is problem. Okay, now I want the assistant to push along the humerus, and then also his hand here to stop the scapula from coming up. So you stop the scapula, lateral glide, and also you provide a correction to the lateral rotation. So you want to do that.
Rotation.
Yeah. So that and that. Okay. And then me as the therapist, I would reduce that V angle. Okay, and also I wanted to hold the scapula down. Okay, where do we put this hand? So I want this part here of my hand between our hands to make contact as far lateral as possible on the spine of the scapula. So if I do this, again, I'm still on it. If I keep going, slip off. Okay, so as far lateral as possible on the spine of the scapula. There. Okay. All right. So therapist, you can skip here. Good. Yep. Good. So me as the therapist, I hold this down. Okay, and I also try to squeeze the clavicle towards to reduce that V angle. That V angle, I want to squeeze that like that. Okay, and you push along the humerus. Okay, and then stop the lateral glide, lateral rotation, and the patient will be elevating the arm further. Okay, elevating the arm further. Okay, good. Okay, and again. So, patient lift up. Okay, good. So it should be pain-free. It should be pain-free if this technique works.